Hey guys, it's Dr. Hub. Today we'll look at the WHO guidelines. So the WHO guidelines, this will be pertaining to the drinking water quality. Drinking water quality of 2017. So first we need to look at the physical parameters. So under the physical parameters, we'll look at the turbidity. So the turbidity, the guideline values, it is no visible turbidity. So there is no visible turbidity, but the permissive standard is going to be less than 1 NTU. So the full form of NTU is the nephelometric turbidity levels. Nephelometric turbidity levels, and this is for the household drinking water. Household drinking water. So this, it describes the cloudiness of water. So this will describe the cloudiness of the water. There is a greater than 4 NTU. This is the cloudiness is visible in the naked eye. So the cloudiness is seen in the naked eye. So in case the less than 4 NTU, this is measured only by instruments. So it's measured by the instruments. Next we have the color. So color, the guidelines values, it is ideally no visible color but permissible standard. There is no visible color, and the permissible standard is going to be less than 15 TCU. That is the true color units. Greater than 15 TCU, it is detected by naked eye. Next, we will go to the taste, color and temperature. Taste, odor as well as the temperature. So there is no health-based guidelines values. There is no guidelines, and it may indicate the contamination and the pollution. And the high water temperature may enhance the growth of microorganisms. The high water temperature, it enhance the growth of microorganisms, as well as influences. It influences taste, odor as well as the color. Then we move on to the chemical parameters. So under chemical, it includes, there is ammonia. And what is ammonia? In ammonia, there is a no health-based guidelines value. The natural levels in the surface and groundwater. The natural levels in the surface and the groundwater. So this is going to be 0.2 mg per liter, and in case of the anaerobic groundwater, this is going to be 3 mg per liter. Aluminium is up to 0.9 mg per liter. Arsenic is up to 0.01 mg per liter. The levels in natural water range is from is going to be from 1 to 2 microgram per liter. Chloride is 250 mg per liter, and as above this it is a detectable taste appears. So above this a unique taste appears. The maximum permissive level is going to be is going to be 600 mg per liter. There is a sodium thiosulfate. There is sodium thiosulfate, and this can be used to dechlorinate the drinking and tap water. There is dechlorinate drinking as well as a tap water. Then comes copper. Copper is it is up to the 2 mg per liter, and excess of copper. So there is excess of copper in water. The excess of copper in water can have a gastrointestinal effects. So they can be the gastrointestinal effects, that's GI effects. Then comes the fluoride. Fluoride is basically up to 1.5. It is up to 1.5 per liter. And above this there is a risk of the dental. Above this there is a risk of the dental and the skeletal fluorosis. The skeletal fluorosis. There is a artificial fluoridation. There is artificial fluoridation, and this range will be from 0.5 to 1 mg per liter. Next we look at the hydrogen sulfide. Hydrogen sulfide, there is a taste as well as the odor. The threshold is between a 0.05 to the 0.1 mg per liter. This includes a rotten egg smell, and this is a water. This indicates the presence of hydrogen sulfide. Next we look at the nitrates. In nitrates, it includes the 50 mg per liter. This will be the nitrate ion. This is going to be the nitrate ion, and this is to prevent the methemoglobinemia. So it prevents the methemoglobinemia and as well as the thyroid effects. So methemoglobinemia and the thyroid effects. Then nitrites. Nitrite is going to be the 3 mg per liter, and this will be to prevent the 3 mg as the nitrate ion, and this is to prevent the methemoglobinemia. So prevent the methemoglobinemia, and this is in a bottle-fed infants and general population. This is in bottle-fed infants as well as the general population. In case of pH, the acceptable pH is going to be in the range of 6.5 to the 8.5. In terms of lead, it is up to the 0.01 mg per liter. So the concentration of lead, it must be kept as low as possible. So keep it low as possible. And in most undesirable metal in the drinking water, it is a most very important, most undesirable metal, most undesirable metal, and this is seen in drinking water. Then comes mercury. The mercury is there is 0.006 mg per liter, This is for the inorganic mercury. It is for the inorganic mercury. And this is going to be, it is a nephrotoxic. Next we look at the polyaromatic hydrocarbons. This polyaromatic hydrocarbons. So in short, it is known as a PAH. There is the benzo, pyrene. So this is up to the 0.0007 mg per liter, and they are kept in traces. They are kept in traces as they are. It's carcinogenic. It's carcinogenic as well as it is mutagenic. Then comes the sodium. The sodium is above the 200 mg per liter. It may give an unacceptable taste. The TDS means the total dissolved solids. So this is less than 600 mg per liter. Less than 600 mg per liter is generally considered as palatable. The TDS it consists of an inorganic salts. So there's inorganic salts as well as the small amounts of the organic matter. So organic matter is dissolved in the water, and the water is completely unpalatable above the water. It is unpalatable, and this will be about the 1200 mg per liter. Next we'll move on to the biological indicators. In case of biological indicators, we look at the total coliform bacteria. So they are the primary bacterial indicators for the drinking water. The primary bacterial indicators, and this is specifically for the drinking water. The total coliforms, they are good indicators of water disinfection. They are good indicators, and this is of the water disinfection. So the water disinfection, and this is because they are abundant in the human intestine. They are abundant in the human intestine, and also they are foreign to potable water. They are foreign to the potable water. The E. coli is considered a best indicator for the fecal contamination. So E. coli is specifically for the fecal contamination of water when the resources for the supplementary microexamination are limited. Then the guidelines state that the coliforms, it must not be detected in the 100 ml of sample water. The coliforms, they should not be detected in 100 ml of the sample water. Next we look at the multiple tube methods. So this is a test of the bacterial surveillance of drinking water for the coliforms, and thereby the fecal contamination. So for drinking water as well as the fecal contamination. And these tests are based on the most probable number. They're based on MPN, that is the most probable number of coliform organisms. There is the acid and gas production. There is acid and the gas production, and this is from the fermentation due to coliforms. This is due to the fermentation due to the coliforms, and they are observed for multiple tubes. They are observed for in multiple tubes, and also presumptive coliform count, and also presumptive coliform count is seen. The confirmation of the E. coli can be done for testing the indole formation. E. coli confirmation. This is done by testing for, so you test for the indole formation. Indole formation, and this will be at 44 to 45 degrees Celsius. Or another test is the Eachkman test. The fecal streptococci. The fecal streptococci, their presence in water indicates the recent contamination with the feces. So recent contamination of the feces, and they are regarded as a specific indicators for the human fecal pollution. They are specific for the human fecal pollution. Next, we are seeing the Clostridium perfringens. So here, they are the spore-forming organisms. So they are spore-forming organisms, and they are resistant to many disinfection methods. They are resistant to many disinfection methods. They are used as an indicator of protozoa. So it's an indicator of the protozoa. This is in water, the indicator of protozoa in water, and also a remote or intermittent fecal contamination. Also for the remote or the fecal or the intermittent fecal contamination. The spores are also indicators of the effectiveness of filtration process. So the spores are also the indicators, and this will be for the effectiveness of the filtration process. There may be viruses like the enteric virus. So they can be used as indicators for the disinfection process. They can be used as indicators for the disinfection process. Then comes the heterotrophic plate counts. There is heterotrophic plate counts. So this measures a wide range of heterotrophic organisms. So there is wide range of heterotrophic organisms, and it includes the bacteria as well as the presence of the fungi. Next is the coliphages. The coliphages as well as the bacterioids. This is the fragilis, bacterial fragilis phages. So they are evidence of the fecal contamination in water. The fecal contamination, and this will take place in the water. Then comes the radiological aspects. So here in radiological aspects, the proposed guidelines for the gross alpha activity. This is 0.5 BQ, 0.5 BQ per liter, and for gross beta activity, it is 1 BQ per liter of drinking water.